Hi, I'm Dr. Elliot Rose. I would like to tell you about some of the exciting work we do in facial, cosmetic, and reconstructive surgery and introduce you to some of my patients.
It's only the name of a TV show, but for one of the stars of Touched by an Angel, it truly happened. Della Reese's indomitable spirit was almost extinguished one fateful day 25 years ago. She crashed into a sliding glass door, floundering in shards of the broken glass, making her wounds even deeper as she struggled to get up. By the time she reached the hospital, she was in shock. Della's cuts were so severe, paramedics had to hold her body together in the ambulance. But Della was touched by a real-life angel, young resident doctor Elliot Rose.
I was on call in the emergency room that night, and I was beeped to come down stat because I was told that a very well-known entertainer had a very tragic accident.
Entertainment Tonight reunited Della with her angel. Since the accident, the two had lost touch and had not spoken in years.
God bless you.
At their first meeting, Della had practically no pulse, and her life was hanging by a thread.
Honest to God, she was almost a goner. We later assessed that she had lost 7 units of blood. That's 7 pints of blood out of a total of 9 pints. I mean, it's almost impossible to live with that amount of blood loss. When I saw the injuries, there were slashes everywhere. Slashes on her scalp, on her neck, body. There was one on her leg that extended all the way down to the bone. And my first thought was, if this has cut a nerve, then she'll never walk again.
Your care and attention is what kept me here.
She was stabilized and then went through extensive surgery to repair her wounds, which required more than 1,000 stitches. Later, when they healed, another doctor removed her leg cast and pronounced the good news. Dr. Rose brought his family to this very special reunion.
Do you know now that you've been touched by an angel?
Now that long-lost friends have found each other again, they promise to keep in touch.
You are my special, life-saving angel, Della Reese. Yeah, and you're my angel, too.
After he stitched Della back together, Dr. Rose decided to make reconstructive surgery for victims of accidents, violence, and dog bites his life's work.
Everybody. Today we're going to meet women who have suffered tremendously because their faces were horribly disfigured. They were scarred by terrible accidents or rare physical conditions. Now, all of them have gone through many hours of painful reconstructive surgery to transform their appearance, and today each of these women is behind the screen because for the first time they're going to reveal her new looks to somebody from their past. Now, all these women have one thing in common, and that's the guy who is here with us today, because he's the one who these women say performed the miracles. It's the doctor who helped them regain their confidence and self-esteem when he gave them back the one thing that they felt they were missing, and it was a new face. Dr. Elliot Rose. Doctor, nice to see you again.
Most of the patients have had multiple other revisional surgeries, or early skin grafting, or fixation of fractures, or other work, and oftentimes we're told that nothing more could be done.
Yeah, and so what is it? Is there a different perspective in your world when it comes to reconstructive surgery? I mean, some say this is enough, this is all we can do, and then you say, no, we can do more. I mean, is there a division there?
Well, I think the key is to be on the cutting edge of the new surgery and the new technology that's available. I have a background both as a reconstructive microsurgeon and a cosmetic plastic surgeon. And by combining those two disciplines, we're able to not only restore the functional ability of the face, but also focus on the complexities of improving the aesthetic appearance as well.
I know, Dr. Rose, you've written a book on your technique.
This is a book that is written primarily for other plastic surgeons. It's entitled Aesthetic Facial Restoration, which shows my strategy combining microsurgical techniques, facial recontouring, computer technology, traditional cosmetic plastic surgery, and laser technology, all of which come together to restore faces that have been very disfigured.
From ABC News, 2020 continues. Once again, Hugh Downs. Tonight we're going to tell you about a hidden epidemic that has left hundreds of thousands of Americans badly injured, some even maimed and disfigured for life. And you may be surprised to find out that dogs attack and bite an estimated 5 million people each year in this country, most of them children.
The statistics show that 40% of all dog bites in children involve loss of tissue of either the lips, the nose, or the cheeks. Hello.
Hi, how are you? Nice
Hi,
to see you.
sweetheart. How are you?
Dr. Elliot Rose, a plastic surgeon at New York's Mount Sinai Hospital, has worked to reconstruct the mouth of Lisa Evangelista, who was attacked by a beagle when she was 7. He says there are 2 types of dangers from dog bites.
Are your lips hurting at all?
No.
One is a penetrating type injury in which the dog's teeth will cause small entry wounds, but may potentially cause severe infection. And the second type, and that's the type that where the teeth grab the skin, pull it, and actually tear it away.
Now, copy this.
Now, a ride to work turns to terror, leaving a young woman cruelly disfigured. Tonight, the amazing story of how her courage and modern medicine saved her.
17-year-old Maymay Liu has a lot to celebrate this holiday season. Almost a year ago, she was viciously slashed in a subway attack. Her once beautiful face was turned into a road map of pain and sadness. 4 months after her attack, Dr. Elliot Rose offered to reconstruct Maymay's face and at the same time rebuild the young girl's life.
The patients often go through a denial process.
In 3 separate surgical procedures, Dr. Rose removed some scars and rerouted others, disguising the most obvious effects of Maymay's tragic attack.
We could think of no better time to introduce you to 28-year-old Bong McDoran, a young American woman who has suffered life's hardships, but beaten the odds. From a distance, she's just another face in the crowd. But as you're about to see, there's nothing ordinary about 28-year-old American Bong McDoran. When Bong was only 2 years old, her world was shattered during the 1968 Tet Offensive. The grenade which destroyed her face also killed her mother. Meet Mount Sinai Medical Center's Dr. Elliot Rose. For the past decade, the New York plastic surgeon has been working on Bong's face and donating his services to make her whole again.
When I first met Bong, she was shy, but I could see the gleam in her eyes. It was a personality that was just waiting to emerge. After talking with her for about 5 minutes, I no longer saw the physical deformity of her face.
Dr. Rose is a very good professional, and he's got the most wonderful bedside manner.
Okay, I'm ready to stand up here.
After almost 45 facial operations, the day has finally arrived. This morning is Bong's final surgery to correct her face. 5 months after Bong's final surgery, she arrives back at Dr. Rose's office to show him the results.
I don't think this is me.
Finally, after a lifetime of fighting the odds, Bong McDoran's difficult journey comes to a close.
This is your plastic surgeon, Dr. Elliot Rose. For me, looking at her from here, it's very difficult to see any scarring. I notice a little teeny something right here, but that is it. You've done an amazing job. It's been a lot of surgery, has it not?
It certainly has. Maymay underwent an 8-hour operation at Mount Sinai Medical Center in New York City in order to remove the disfiguring scars, realign the tiny little muscles around her eyes and her lips, and essentially allow those scars to be hidden in the creases and planes of her face.
It must be very difficult because of the emotional trauma connected with a patient like this. This is not somebody who comes in and wants to change the way they look. Your work must have been doubly hard in some ways because you were trying to reconstruct a beautiful woman back to what she was after such a savage beating or attack.
Well, it was difficult from the standpoint of trying to restore her delicate features, but it was so enhanced by her positive attitude. I think Maymay has become a role model for other teenagers, someone who has faced adversity, confronted the ambiguity of appearance, and has faced these and has come out, I think, a much better person, not only physically, but emotionally as well.